Welcome to this explainer. Today, we're going to look at the human body through a completely different lens. When we think about medicine, we usually picture the doctor in the clinic, the surgeon in the operating room, or maybe the nurse right there at the bedside. But there's this entire world of high-stakes, microscopic detective work happening behind closed doors that dictates almost every major medical decision. It's the absolutely fascinating study of pathology.
Think about it for a second. When a really complex case comes into a hospital, who actually diagnoses your disease? You might think it's the physician who examines you, but actually, very often, they're just gathering the evidence to send to the ultimate medical diagnostician, the pathologist. They are the ones working entirely behind the scenes, looking at the structural and functional breakdowns in our bodies to definitively say, right, this is what's wrong.
Okay, let's dive into this. Here is our roadmap for today. We'll cover the science of suffering, decoding disease and illness, anatomy of a normal cell, the origins of disease, and finally, the branches of pathology.
Section 1. The Science of Suffering, Uncovering the Root Words.
To really grasp what pathologists do, we kind of have to look at the name of the field itself. The word pathology comes from two ancient Greek words, pathos, which translates to suffering, and logos, which means study. So pathology literally translates to the scientific study of suffering. It's the scientific study of the structure and function of the body in disease. Essentially, pathology is all about examining the abnormalities that pop up in normal anatomy and physiology when disease strikes. When your body's homeostasis completely breaks down, the pathologist steps in to figure out why.
And because pathologists are the ultimate diagnosticians, a deep understanding of this field isn't just for the folks hunched over microscopes. It is absolutely crucial for all would-be doctors, general practitioners, and specialists. Unless a doctor really understands this specific language, the causes of a disease, the mechanisms of how it works, its exact nature and type, they literally won't be able to read the clues. They have to understand the language spoken by the pathologist in those laboratory reports to effectively treat you.
Section 2. Decoding disease and illness, the clues.
Now, what's really interesting about this is how precise the vocabulary has to be. In any investigation, words matter. We often use certain terms interchangeably in everyday life, right? But to a medical detective, they are vastly different. Take disease versus illness. While disease implies a specific entity with a very distinct cause, an actual interruption of the normal structure or function of the body, illness is a completely different ballgame. Illness is the individual's subjective reaction to that disease. It's how you, the patient, actually experience the condition. You suffer from an illness, but the doctor hunts for the underlying disease.
We actually see this exact same split between subjective and objective when we look at symptoms versus signs. Symptoms are the functional, subjective evidence of a disease. This is your complaint when you walk into the clinic. It's the difference between you saying, "Man, my stomach hurts," which, let's be honest, could mean anything from appendicitis to bad takeout, and the doctor finding a highly specific, localized swelling during a physical exam. Your stomach ache is the symptom. That localized swelling, that's the sign. And when these clues consistently group together, we get a syndrome. The word syndrome actually means running together. It's defined as a combination of symptoms caused by altered physiologic processes that consistently occur together. When a diagnostician spots a specific syndrome, it's exactly like finding a distinct pattern at a crime scene. It immediately narrows down the suspect list. Let's look at the rest of the evidence sitting on the detective's desk. You have the patient, who is simply the victim of the condition. Then you have lesions. These are the literal footprints the culprit leaves behind in your tissues and cells. To find them, the pathologist examines the morphology, or the structural changes. They do this either with the naked eye, which we call gross examination, or by zooming way in with a microscope to see exactly what the naked eye misses.
Section 3. Anatomy of a normal cell, the crime scene. Okay, before a detective can figure out how a break-in happened, they have to know what the room looked like before it was trashed. In pathology, our primary crime scene is the cell. Now, you likely already know the basics. The nucleus holds the genetic blueprints, the cytoplasm houses all the working organs, and the cell membrane is the security gate that rigidly regulates exactly what goes in and out.
Inside that cytoplasm is all this cellular machinery, and yes, we all know the old saying, the mitochondria is the powerhouse of the cell, but to a pathologist, it's the specific energy grid that a disease actively tries to shut down. You have the endoplasmic reticulum synthesizing proteins, and the Golgi apparatus acting as the shipping department. When disease strikes, it's this exact, perfectly calibrated machinery that gets hijacked, damaged, or just completely destroyed.
Section 4. The origins of disease, motive, and method.
So,
This is where we explore exactly how and why our cellular machinery breaks down. The crucial starting point is understanding etiology. Etiology refers to the causal factors responsible for those lesions we talked about. If you're a medical detective, etiology is the why of the disease. It's the literal motive or the specific trigger that initiates the damage in the very first place. But once we know the why, we really have to figure out the how, and this is called pathogenesis. Pathogenesis is the step-by-step mechanism of how a disease develops, from its very initiation all the way down to its cellular and molecular manifestation. It explains exactly how those macroscopic and microscopic lesions are actually formed in your tissues and organs. Basically, it's the method of the crime.
So who are our usual suspects? Well, disease etiology generally falls into two different lineups. First, you have your infectious agents, your classic bacteria, viruses, fungi, and parasites. Then, you have non-infectious agents. And this is everything from physical trauma and radiation to environmental poisons and chemical agents. These are the culprits that pull the trigger on pathogenesis.
From there, the pathologist evaluates the entire arc of the attack. They look at the nature of the disease. Is it acquired, like an inflammation? Is it congenital, meaning something you were just born with? Is it a tumor, or maybe a pathophysiological functional disturbance? Finally, they determine the prognosis, which is the expected end result of the disease's attack. Will it result in a full recovery, or is the patient going to develop new complications down the road?
Section 5. The branches of pathology, investigative units.
And this brilliantly illustrates just how massive this field is. Because disease can attack the body in countless ways, pathology isn't just one single job. It requires an entire precinct of specialized investigative units. We've got gross pathology, studying organs postmortem, histopathology, diagnosing things like tumors through microscopes, clinical pathology, running all those lab tests, cytopathology, examining individual single cells. We even have comparative pathology crossing species lines, experimental pathology using models, immunopathology studying our defense mechanisms, toxicopathology focusing on poisons, and of course, forensic pathology, investigating suspicious deaths. It is literally an entire precinct of specialists.
Which brings us to a final thought I want to leave you with. Pathology teaches us that disease is an interruption of an incredibly complex, perfectly balanced normal state. Knowing how many different etiologies exist out there and how intricate our cellular machinery actually is, what unseen microscopic battles are happening in your cells right now? Battles being fought and won without you ever even feeling the illness? It really completely changes how you appreciate your own biology. Thanks so much for joining me for this explainer, and keep your curiosity alive.